Hello everyone. My name is Jonathan Cheon and I am a fourth-year medical student at Michigan State University, College of Osteopathic Medicine. Today I will be presenting on the effects of Shinbaro-II on rat models of lumbar spinal stenosis. Lumbar spinal stenosis is a major cause of chronic low back pain with a projected prevalence of 400,000 in the US and is defined as any narrowing of the lumbar spinal canal, nerve root canal, or intervertebral foramina. Some common symptoms of lumbar spinal stenosis are midline back pain, radiculopathy, motor weakness, paresthesia, and impairment of sensory nerves. Thus far, only a few therapies have been shown to have limited efficacy in treating LSS with functional recovery such as surgical decompression and pharmacologic interventions. Shinbaro-II is a refined traditional herbal formulation that is used for treating inflammatory lesions as well as musculoskeletal pain in conditions such as hand osteoarthritis and sciatic pain with lumbar disc herniation. This study aimed at investigating the effects of Shinbaro-II on LSS and at determining its underlying molecular mechanism in rat models. For this experiment, an in vivo spinal stenosis rat model was used by inserting a piece of silicone block using a 26-gauge syringe at the L4 to L5 spinal level, and Shinbaro-II was administered per Oz or intraperitoneally for 14 days. The rat behaviors were assessed by evaluation of locomotor activity by counting the number of steps on a running wheel and nociceptive responses to heat stimulus. H&E staining, measuring serum marker levels, Western blot assay, and RT-PCR were used for various data collection procedures. Figure 2 from the study demonstrated that Shinbaro-II showed significant improvements post-operatively in both motor function and heat reactivity on 7 days post-op and 4 days post-op respectively. Administration of Shinbaro-II or estradiol led to structural recovery of the LSS-induced damage. As you can see in Figure 2a, the normal is without surgery, control is with LSS surgery but no treatment, and the rest are Shinbaro-II treated groups, which show significant improvements in motor function. In Figure 2b, you see that the latency drops drastically at 4 days post-op, which means that the time it takes for them to react decreased, and therefore sensitivity to heat increased. In Figure 2d, we see how the Shinbaro-II and estradiol demonstrate much fuller spinal cords as compared to the control. Figure 5 was showing how the anti-inflammatory effects of Shinbaro-II in the lumbar spinal stenosis rat model are partially associated with the suppression of NF-kappa beta activation, as demonstrated by the downregulation of P65 and P50, which are subunits of NF-kappa beta in the Shinbaro-II treated groups. As you can see on this graph, the relative intensity, which corresponds to the protein levels of P50 and P65 in the groups treated by Shinbaro-II, were significantly lower than the control. Figure 6 suggests that Shinbaro-II suppresses BDNF protein and mRNA expression. This can be seen in this graph on the bottom right, which shows how Shinbaro-II treated groups had lower BDNF expression. BDNF is a key member of the neurotrophin family, which include important regulators for neuronal survival, growth, and differentiation. This molecular mechanism may explain how Shinbaro-II promotes neuroplasticity and pain relief while promoting functional recovery. In conclusion, the findings from the study support the current clinical applications of Shinbaro-II and has shown it can improve LSS symptoms as well. Inhibiting inflammatory mediators, pro-inflammatory cytokines, and neutrophilic factors reduce LSS symptoms. Therefore, Shinbaro-II effectively reduces LSS symptoms. Thank you for your time, attention, and hospitality.